We're back with another hour of Today on a Wednesday morning, the 16th day of May, 2007. Just a beautiful day out on the plaza, kind of warm, nice crowd gathered, and a cameraman just ran into something. If that's okay. Maybe it was a butterfly. Who knows?
A very big butterfly.
Or maybe it was that hissing cockroach. Anyway, we've got butterflies on the plaza.
And this morning on I Feel Good Today, being heart smart. Heart disease is the leading cause of death and disability for women in America. In fact, 1 in 3 women has some form of cardiovascular disease. Well, Dr. Nieca Golberg is medical director of New York University's Women's Health Program, and she's the author of something called the Women's Healthy Heart Program. Dr. Goldberg, good morning.
Good morning, Ann.
May, you say, is Women's Health Month.
That's right, and heart disease is the leading cause of death and disability in American women, and oftentimes women do not take care of their hearts.
In fact, the First Lady was just talking about how we really need to spend more time thinking about this. So what is the first thing we need to think about?
You need to think about what is your risk for heart disease. In fact, going to the doctor and getting a checkup to get your blood pressure checked, your cholesterol checked, and your sugar checked to see if you're diabetic. But there are some really important things that you can do in your own life, such as exercising. I love to exercise because as a busy person, I like to pick that one thing I know that can hit most of the risk factors. It lowers blood pressure, improves sugar, strengthens your bones.
How much and how intensely?
You need to do at least 30 minutes a day and taking a moderate paced walk.
At least 30 minutes a day? Of how intense?
Moderate pace, like a 3.5 mile walk. You know, it's the average pace of a New Yorker walking in the street. But if walking isn't your thing and you like to go ballroom dancing after work, then you can do that. I always thought that my mom was in great shape because she actually cleaned the house very vigorously all the time, and 30 minutes of vacuuming actually is aerobic exercise.
Oh, there you go.
I might not choose it, but it's a way to exercise.
Well, if you've got to do it, why not use it to a good end? Okay, also, reducing stress. And we've been told there's good stress and bad stress. The bad stress, we know, just makes us feel bad. But it's so hard to reduce it. But this is about taking care of ourselves and living a long life.
That's right. I think when we talk about stress, it's really all of us have so much on our plate. One of the first things I tell my patients is to stop volunteering for every job. You need to really develop a network of supported friends and family members who can help pick up the slack. You know, close the door of your office in the midday and take some deep breaths because it actually lowers your heart rate and blood pressure. And one of the things I do is go to the gym and exercise. In fact, my friends tell me I'm a lot easier to be around if I go and exercise regularly. It really improves your mood.
I'm sure it's true for all of us.
Absolutely.
You also say eat healthy. Of course, don't smoke because that's a key issue. Get a checkup and check your cholesterol level. These are all good ideas. But what about aspirins? I've been hearing about, we've all been hearing about whether if you take a certain aspirin, men specifically, an aspirin a day might lower. Is that true?
Aspirin, it's been very confusing to women.
Yes.
So here it is. Plain and simple. For all women who've had a heart attack, aspirin prevents a second heart attack. For women over 65, it prevents a first heart attack and stroke. And research shows that aspirin reduces risk of a stroke for women over 45. But the best thing you can do is to really bring up that conversation with your doctor to make sure it's right for you.
You know, a lot of women wonder whether they are at higher risk if some member of their family has had a heart attack or has had heart disease. Is that probably true?
Family history is a very important risk.
Okay.
If your mom was less than 60 or dad less than 50 when they had their first symptoms of heart disease, that increases your risk by 25 to 50%.
Okay, that's a big key.
You can't change that. You can't change that. But you can do those things like exercise and really eat a healthy diet, cut down on saturated fats and whole fat dairy products. Don't eat trans fats. So look at food labels and anything that says hydrogenated, don't eat it. And eat vegetables that are red, green, and orange because they're rich in B vitamins and antioxidants that actually lower your blood pressure and make your arteries resistant to clogging.
What about hormone replacement therapy? Some women are very worried. Should they be worried about having a higher risk if they take that?
Hormone therapy helps menopausal symptoms and is still one of the most effective therapies. If you take it early as you go into menopause and have the symptoms of hot flashes and really get a good checkup with your doctor, it's generally safe to take for about 5 years.
Probably what you should probably do is check with your doctor if you've had a history of heart disease and talk to them about all of these risks and what adds to your risk, so you make sure that you stay around.
I think in particular with hormone therapy, when you're considering, it's a good opportunity to get your cholesterol and blood pressure checked and make sure it's right for you.
Bottom line, you want to stick around for your kids and your grandkids, so take care of yourself, and that's a good bit of advice to any woman or any man for that matter. Thank you so much, Doctor.
Thank you
for joining us, Dr. Nieca Golberg. And up next, the American Idol Countdown, but first, these messages.